Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. All right, welcome everyone to episode 17 of the Canine Culture Podcast. We have a special guest on today, and her name is Amanda, and we are going to be talking about dentals for doggies. So welcome to the episode, Amanda. How are you?
I'm good. Thank you so much for having me.
Yeah, so tell everyone a little bit about what you do.
So I am a licensed veterinary technician, originally from Tennessee, but we move around a lot. So I've kind of lived a bunch of places, but my passion lies in veterinary dentistry. So I actually worked with a veterinary dentist for 3 years. His passion was dentistry as well, and he really kind of helped me focus all of my attention to something that I think is really important for every pet owner, dog owner out there. And we just don't think that much about it, but it's something that most animals actually have an issue with. So my passion in life is just to discuss veterinary dentistry, make sure owners are aware of what they're doing and not doing. But I clean dogs' teeth all day, and I love it.
That's awesome. Yeah, we are very familiar with dentals in our household because we've always had Pomeranians, and I'm sure you see a ton of Pomeranians with terrible teeth.
Oh,
It's
yes.
a thing. So we usually do like once a year dentals, and we find that with most of our dogs that we've had, by the time they get to 8 or 9, sometimes 10 years old, we seem to be doing 2 dentals a year, and then we start seeing more of like the extractions and things like that. So we're pretty familiar with it, and it's kind of interesting too. Like over the years, I feel like it has gotten a little more popular, which is a good thing.
Yes.
But with that, I've also noticed, like in Jacksonville, Florida, prices have skyrocketed on dentals. So, like, I feel like in Ohio and West Virginia, you can get one for, I don't know, between $400 and $600. It seems like in Texas, maybe between 300 and 500. In Jacksonville, I haven't seen dentals under $1,000 for a few years. So
Yeah. Yep.
kind
Prices.
of kind of
Sure.
interesting. Yeah, yeah. So tell everyone exactly what it means when a dog gets a dental. Like, how do you define a dental?
Sure. So dental or dental cleaning or dental prophy, that's just all kind of veterinary jargon for dental prophylaxis. Prophylaxis is just a big word that means to prevent disease. So when someone's talking about a dental prophy, they're talking about getting your dog's teeth cleaned and addressed to prevent any future disease. So just like when we go to the dentist every 6 months or a year or whatever our dentist has us do, we're just kind of making sure we're preventing that disease in the future. We're not wanting to have any of those issues. In veterinary medicine, though, as we all know, and we look in our pets' mouths and they just don't look good, we're actually not preventing disease as much as we want to. It's a bit of a misnomer when we say dental prophylaxis. So something that a lot more vets are reaching toward is something that means a little bit more of what they are doing, and probably why you're seeing those prices change in some places. One of the most common ones that people are switching to is an acronym called COHAT, COHAT. It stands for Comprehensive Oral Health Assessment and Treatment. And it's just kind of breaking down actually what we're doing when we're seeing these animals come into us. We are looking at their facial structure, we're looking at their teeth, we're taking x-rays, we're cleaning the teeth. And then if we're finding an issue with any of that, the veterinarian's actually getting in there, assessing that issue and treating it before they go home. So we kind of just tie that all up into dental sometimes. So if your vet or if someone ever says dental to you, they're kind of meaning we're going to get in there, we're going to muck out the stalls and fix any issues that are in there and make sure your pets are feeling a lot better. And, we're going to get you good to go home.
So, tell us a little bit about the process for when a dog does get a dental. I know it's a little bit different for all dogs. Like, sometimes you have blood work, sometimes you have x rays, but just generally talk about the process of the dog going through the procedure.
Oh, sure. I would say the most important thing to do before you have the procedure would to be have your consult. We grade dogs and their dental disease in 4 different stages, grades 1 through 4. So grade 1 being something that's just a general cleaning, that is your dental prophy. And then grades 2 through 4 being something that they have disease that may not be reversible. We may be having some extractions and things like that. So knowing what you're getting into before you go in to have a procedure done is super important for the vet and for the owner, just so everybody is aware of kind of where we're at. Do we have an animal that has a lot of issues that we might be there a little bit longer that day? Or is it something that we're just expecting a quick cleaning and going home? So we get you scheduled. You come in the morning, just like you would for any other anesthetic procedure. If you haven't had blood work already, we're doing blood work in the morning. We're placing an IV catheter so we can give some, fluids and some medications to that IV. We are going under general anesthesia. So we're going to induce general anesthesia, and we're going to intubate. So that means putting a tube into the throat, and protecting the throat. So because we are putting a lot of water and a lot of things are happening in the mouth, we don't want anything to accidentally go down into your airway. After we get you intubated, we are going to start taking x-rays usually. It's really important to find a vet that has a staff that knows how to take and read dental x-rays. That's one of the probably things that you've seen prices change a little bit in your area, is if you have a person that's doing those things correctly, you're going to have a little bit of a price bump just to kind of make sure we're, taking care of the issue at hand. So once we get all those x-rays, the vet is going to read them and look at each teeth individually. Dogs have 42 teeth in their mouth. Compared to people, we only have 32. And whenever a vet or a technician sits down in a mouth, we have 42 little patients that we're looking at individually. We don't look at the mouth as a whole. We're breaking it down into different sections. So that's 42 little patients that we have to get in there, clean and x-ray and look at and make sure everything's good to go. Once everything's cleaned up, and if any issues arise, like say you have a dog with a broken tooth or a little bit of an infection around one and it needs to be extracted, the vet will do that. We close everything up. And then, we give them a couple pain medications, make sure everybody's happy. We don't want any pain in that mouth whatsoever. That's not a comfortable thing to have. And then we wake them up. And in a few hours after they've fully recovered from that anesthesia and they're ready to go home, we like to send them home usually the same day or the next morning, just depending on what kind of dental work they had done.
So, a couple things that you said, you did mention the blood work, which I know that I've always opted in for the blood work. And I've noticed, and I think this is to be price conscious, a lot of vets will give you the option of doing the blood work. So, um, are there different levels of blood work you can do? Like, I know sometimes they identify blood work as like senior blood work, and I think they go a little more in depth on the panel. But if I am an owner and I'm being as conscientious as possible, do I have options with respect to the blood work, like choosing what gets done and what doesn't get done?
Of course. So with the blood work, you have just general blood work. That's usually looking at your CBC, which is your complete blood cell count, your red cells, your white cells, your platelets, making sure everything's clotting appropriately and that you don't have any infection from your white cells or you don't have any anemia issues or anything like that from your red cells. It also usually comes with a chemistry panel. So that's going to be looking at your liver values, kidney values, different organ values that kind of signal to us that there's an issue. It looks at their cholesterol and things like that. That's usually just a general panel that we use for most things. So if you come in for kind of yearly blood work, or even just kind of a young animal that's deemed healthy, we kind of just want to check before we go into surgery, just because as, medical professionals, we want to ensure everybody is safe during their procedure. We don't want to just look at somebody and go, okay, yeah, let's put you under anesthesia. There could be an underlying issue. There could be something going on that we just don't know about unless we run that blood work. You can run bigger things. So if you have an older animal with a geriatric panel, those things are going to look at more kidney values. They're going to be looking at usually your glucose to make sure there's no diabetes issues. They're going to be looking at your thyroid to make sure there's no thyroid issues. It's just a bit of a bigger panel with more options of things that they look at. It is a little bit more pricey, but if you have an older animal, it's better to be safe than sorry always, especially when we talk about anesthesia. Anesthesia is super safe these days. We use multimodal anesthesia where we're using more drugs, but fewer amounts of the drugs. So we're not just overloading an animal on one thing. So it has become a lot safer, but we just want to take every precaution we possibly can to make sure that animal is fully, anesthetized correctly.
That definitely makes sense because it's kind of like a person. You probably would not go into surgery where they put you to sleep without some kind of blood work.
I don't think they allow people usually to have any sort of anesthetic procedure without, like you said, without some form of blood work. They're going to at least check your glucose and they're going to do a few different tests on you to beforehand to make sure you're ready for that surgery.
And then you mentioned the dental x-rays. So this actually just came up recently with us. We've been getting dentals on our dogs for forever. And we had actually never really had dental x-rays. Most of the vets that I've seen, I guess, don't have that particular machine because it seems to be a very like specific x-ray machine. And so we went to a vet that did have that. And I actually had different vet techs and vets telling me I was wasting my time and money getting the dental x-rays. But as it turns out, it actually showed a few things that we didn't really know about, like a canine that had, and this might not be technically correct, but essentially broken away from the jawbone. I don't think my anatomy is 100%, but I definitely found value in that. So, what kind of things are you able to uncover with those dental x-rays, or what are the importance of getting those prior to the procedure?
Yeah, I'm so sorry that someone told you that you were wasting your money when getting dental x-rays. In my opinion, the most important thing that happens the day that any animal gets a dental with me is us taking those dental x-rays. Those are invaluable things, and that's what I would honestly spend my money on. Even if they didn't clean my dog's teeth, I'd rather have those x-rays to know if there's any issues in the mouth. Obviously, that's exaggerating. You definitely want to clean your dog's teeth, but that's just how passionate I am about taking x-rays, because if you look at a tooth in an animal, you're only seeing 1/3 of that tooth. 2/3 of the tooth are actually above where you cannot see them under the gum line. And so when we're cleaning them, we're only cleaning the part we can see. When you're taking an x-ray, that allows you to see something that you didn't know about. And so before, when that was cleaning your teeth, you were just cleaning the part that you could see. You had no idea that above the gum line, maybe there was a fracture or there was an infection brewing. And, that does cause pain in the mouth, just like people, animals can feel pain. Infection is painful, fractures are painful. And that's something that they hide really, really well until they can't hide it anymore. And then one day your animal just stops doing what they love doing, playing with their toys. Maybe they stop eating a little. And that's really hard to not explain. A lot of veterinarians, thankfully, have been getting these special dental equipment x-rays. When your dog has a broken leg or they needs to, look in their abdomen, we can take a general x-ray. Just like when we take an x-ray, you lay down on a big platform and the cone comes over you and takes an x-ray. We actually have a very small cone and a very small sensor that fits into the mouth. That's why animals definitely need to be under anesthesia for taking dental x-rays. We would hate for them to bite down on that really, really expensive sensor that cost a lot of money. So they definitely need to be asleep for that. But yeah, I think it's one of the most important things you can do for your animal is find a place that has dental x-rays, and that someone knows how to read them and address the issues on the x-rays. Because even if they all come back out perfect and there's no issues, at least hey, not only are my pet's teeth clean, there are no issues, and I can 100% be happy that I spent that money on that. I would hate to go in and just clean the teeth and say, I can't tell you if there's any other issues. I'm really sorry about that. Here, take my money. So I
Right.
really recommend dental x-rays anytime you get a dental procedure, for sure.
Yeah, I mean that definitely makes sense. It is a lot like what we just talked about with the blood work. Same with people. Whenever, like once a year, you're getting your dental x-rays, they're seeing if there's any infections, if you have any loss of bone, just a number of things that you cannot see on the surface. So it definitely does make sense to me, and I feel like with dogs, I mean their teeth are so they do go so high up, like they're kind of like up in that nasal cavity, and they have a lot of different effects on the brain and functionality of that. So catching those infections as early as possible just makes the most sense. So we've kind of touched on this a few times. What do you think is the most important thing about getting a dental? Or, it could be multiple things, but for you, what's the importance when you're talking to an owner of getting their dog in and scheduled for a dental?
Definitely the x-rays, of course, like I talked about. But if I could pick another thing, it would probably be that exam that you're not getting when they're awake. When you come into the vet and the vet looks in their mouth, we're not able to usually, unless you have just the best animal in the entire world and they're super patient, open their mouth, look down into their throat, look under their tongue, look on the inside of their teeth, make sure there's no, we've had several dogs come in that have sticks lodged up inside their mouth, and
Oh, wow.
owners don't even know about it. So I think that what the second most important thing definitely would be, just that extra exam that you're getting when an animal is under anesthesia and the doctor is able to look into the mouth and, like I said, examine each single tooth in the mouth. That's just not something that we're able to do usually on a conscious awake exam in the vet's office beforehand. So I think that's super valuable as well, just to make sure you're seeing every single angle of the tooth.
Yeah, that definitely makes sense. I didn't even think about it. It really is a second exam and a more in-depth exam, so that makes sense.
Mhm.
What breeds do you think need them the most? And I know probably, honestly, all dogs need them, obviously. But as far as who probably needs dentals the most, who would you say that that is with respect to different breeds?
Yeah, there's so many breeds in the world, but the breeds that I have commonly on my table are going to unfortunately be my favorite little small breeds. Dachshunds, pugs, Yorkies, the list goes on and on, mini poodles, anything that has really, really tiny mouth. Chihuahuas, they have really terrible teeth usually, and it's not their fault. I hate to, it's not their fault. It's just their
Right.
genetic. Every single dog, like I said before, has 42 teeth or should. That doesn't change regardless of size. So if you have a
Oh,
Great Dane
wow.
with 42 teeth, they have 42 teeth. Chihuahuas have 42 teeth. So you're cramming all 42 teeth into a little itty bitty, teeny tiny mini mouth. It just sets up shop for a lot more bacteria to be held. They're not spaced out as correctly, and so it's genetically, unfortunately, they do tend to have the worst mouths. But that doesn't exclude big dogs. Great Dane, or sorry, not Great Danes, Greyhounds have really bad mouths for some reason. I see a lot of Greyhounds on my table. I don't know why genetically, but they just don't have the best teeth usually. They require a lot more homework as well. And then larger dogs love to chew on things. So you'll have your labs or your boxers or what have you, and they like to chew on bones, antlers, furniture, cages, anything they can get their mouths in, and they're breaking their teeth. And so that's something that traumatically they're doing to themselves. So I do see a lot of big dogs on my table as well, just because of them chewing a lot of things. And we're having to take some teeth out because they're breaking them.
Mm-hmm.
But usually the ones that when you go to the vet and the vet says, hey, it's time for your cleaning, it's probably going to be a dachshund, a Yorkie, a small breed, a French bulldog, anything like that.
Yeah, yeah, that definitely makes sense. And then as far as age, is there a certain age you should start considering getting dentals? I mean, I feel like I've always heard to wait until they're a little bit older. And now that I kind of think about it, I don't know if you should wait. Why put that off and have to kind of backtrack? And why not just get on a regular maintenance? So, is there normally an age that you would recommend?
Yeah, so the statistic that most vets will probably throw out at you when you're in the exam room, or you'll probably see on a poster somewhere in the vet's offices, is that 80% of dogs over the age of 3 have some form of dental disease. So if you think about that sentence a little bit, 80% of dogs, so out of 100 or out of 10, 8 dogs have dental disease.
Right.
um, Over the age of 3, that's most dogs, that aren't puppies, and some form of dental disease. It doesn't mean their mouths are rotting out of their head, but they have some issue in their mouth that needs to be looked at, or cleaning or something. So almost every patient that I see come into the office needs a dental procedure. But like you said, no, that doesn't stop with puppies. Puppies, you actually need to start at home. You need to be working on your at home brushing, cleaning, treats, whatever you can do to get that mouth as clean as possible at a young age. And then when you come in for your yearly checkup, that's the biggest thing that you're going to want to do is have the vet look into the mouth and just say, hey, you're doing a great job. Or, hey, I'm noticing some issues. Let's talk about what we can do to make sure we're not heading towards the route of getting a dental cleaning, because we don't want you on our table. We don't want the animals to need this issue. We want them to have a healthy mouth. I get more excited with a person who tells me that they're able to brush or do some sort of dental work at home, because that keeps them off my table. That means their mouth is healthy and I don't have to take any teeth out. I want them to keep all of their teeth, and that saves you money. So the more you can do at home and the younger you start and prevent these things, that prophylaxis we talked about earlier, the better. But usually an age that a dog usually starts getting general annual dental cleanings would probably be around age 3, depending on the size of the dog, maybe smaller for our smaller animals. Some 1-year old dachshunds I have come into me because their teeth are already starting to be bad.
Mm-hmm.
But some bigger dogs like labs and things can wait a few years first. But
So you kind of just brought up one of the questions that I had, and what can you do at home? And you and I were talking right before we started the podcast about there's so much marketing for dental cleaning treats, and I don't want to say any brands in particular. I almost just did, but any of those brands that are really identified as these will clean your dog's teeth, this will keep their breath fresh, whatever that means. What can you do at home, and then what treats are, if there are any treats that you find helpful for keeping your dog's teeth clean?
sure. So obviously the gold standard would be to brush your dog's teeth daily. That isn't consistent with most people's lifestyles or even their pets. They just were never, you know, acclimated to having someone with their hand in their mouth. So that's not something some dogs will let you do. And some people just don't have the time. They're working, they're taking care of kids, they're busy. It's just, it takes enough to get us ready in the morning, let alone brushing your dog's teeth every day.
And a quick question on that. What, and this might be a silly question. Okay, so I've seen the dog toothbrushes. And I've seen dog toothpaste, but what do you think people should be using? Because some of those toothpaste that I've seen, it's just a whole list of chemicals, and I'm not totally sure what it is. So, what would you recommend for the quote unquote toothpaste?
Yeah, so they do make doggy toothpaste. Most of them are okay, but like you said, a lot of them have just a lot of junk in them. It's really more so that mechanical action of the toothbrush, though. So if you're using a doggy toothbrush or any soft bristle toothbrush, I even recommend like baby toothbrushes for like the smaller dogs, even, or they make the ones that go over the finger that you can just kind of rub in their mouth and it's like soft
Mm-hmm.
silicone. Just the mechanical action of you doing that with a little bit of water on it is actually going to do so much. The toothpaste is more so just to kind of make it more pleasurable for the animal, because they're usually chicken flavored or peanut butter flavored or something like that. It kind of just goes, okay, your hand's in my mouth for a reason because you're giving me a treat. But those toothpaste also have some, cleaning options in them as well. So some of them have like fluoride or enzymes in them that are actually helping break down some of the, the buildup on the tooth as well. So they are doing things. There's actually a great website that the listeners can go to. And this is what I recommend every single person that I meet that has a question about what works and what doesn't. It's the Veterinary Oral Health Council, or vohc.org. You go to that website, you click on dog or you click on cat on the side, and it's going to give you a list of all the products. This is a third party testing company. And they kind of vouch for these people. They say this product has been tested. It's gone through every test that we put it through, and it actually works. So that way it's kind of like you not having to go out and buy every product and just see if you think they work. These are actually scientifically tested that they do work. Not every product has gone through this testing, and that's okay. There may be products out there that you love and you think are working great. And they might do work. They just haven't gone through the specific testing. But this is just kind of a surefire way to know if it is working or not. Is these people, these scientists have said, yes, it works.
Okay.
It also is a little label on the back of a lot of dog food or dog brushes or treats. It's a little white square and it says VOHC in it. And it's actually going to tell you that this product was certified. So anytime I pick up a product, if I flip it around and I don't see that, I'm a little wary of buying it. It's probably a little bit more marketing than anything else, because there are so many things out there. There's no way all of them can possibly work. But one of them that is actually a really big brand, I don't know if I'm allowed to say brand names on here or anything like that, that people question me all the time, does it work, is the Greenies products. They actually went through the VOHC testing and they are certified to work. And that's something that's readily at almost every supermarket these days. So giving your dog these treats isn't as ideal as brushing, but it definitely is going to do something rather than nothing. It's that mechanical motion of them chewing it. If you make sure you buy the right size, obviously. Most dental treats come in sizes. So if you have a small dog, you don't want to buy them the Great Dane sized treat for the chew, and vice versa. If you have a Great Dane, you don't want to buy them the Chihuahua sized chew. They actually need to be size appropriate because you want them to chew it. And if you don't have a chewer and the dog that's chewing that thing for probably 5 minutes at least, it's probably not doing anything. So even if you're buying all the best products and your dog isn't chewing them appropriately, it's not helping, unfortunately.
Right. One more thing that I had a question for you on before we wrap up. How often should dogs be having their teeth cleaned and or just like looked at?
Mm-hmm. So the at-home care, that should be something you're doing daily. If you're doing it any less than 2 times a week, it's probably not doing anything at home. When you go to the vet yearly or even every 6 months, depending on what your vet has set up for you, make sure they're looking in the mouth every time. Make sure it's okay to, because a vet, unfortunately, sometimes is not going to give you the rundown on everything they looked at. Sometimes advanced exams are really quickly and it just looks like we're petting them, but we are looking at every body system. So just say, hey, doc, did you notice any issues in Fluffy's mouth today? And they're going to be able to let you know if they saw anything, and they can actually show you the mouth, because sometimes it's hard to look in your own pet's mouth. So they'll have someone there holding them and looking in the mouth. So that's something that you should get them checked out every year or every 6 months, depending on how often you go to the vet. Yeah. So just confirm that your vet looked in their mouth, saying, hey, doc, did we find anything in Fluffy's mouth today? They'll be able to let you know, and someone will hold the animal for you so you can look in the mouth with them. If you notice anything at home, obviously you want to check sooner than every year, 6 months. You can bring them in anytime, call your vet and say, hey, I need a dental consult, and they'll be happy to see you for that. If you notice anything like bad breath, that's the number one thing people come into me for, is bad breath, because bad breath is not normal. That means something is going on in the mouth. If you see any blood or them chewing funny or any, kind of build up on the teeth, bring them in sooner. We'd love to see them and let you know what's going on. But I would have them checked every year, and the vet will let you know how often they think they need a dental procedure. Sometimes that is yearly. Sometimes that's less than yearly. I know you said your little Pomeranian, unfortunately, as they get older, sometimes has to go every 6 months now. And that is something we see quite often as well. As we get older. Older pets, just their enamel breaks down and they just don't have the best teeth as they did when they were puppies.
Thank you all for tuning in to episode 17 of the Canine Culture Podcast. Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.